I want to bring the girls on because you're getting some comments here, Luther. Well, amazing, and let's do that again. Awesome, Simone. And Deanna was like, it makes me aware that my body needs a lot of work.
Absolutely.
We're all there, love, for sure. Some of the ladies, I know some of you had sent me some questions beforehand, so I'm gonna just jump on you first here. Tara, did you want to unmute, love, and you can ask Luther whatever it is you'd like.
I would love to. Can you guys hear me?
Yes.
Awesome. Hi, Luther. Thanks for everything. That was incredible.
Sure. My pleasure.
My question, my question is I have a hip that since birth always seems to want to pop out or kind of pigeon toe me. And I was wondering if you have some stretches or some advice for helping the muscles because it often feels like I get tight up my lower back from compensating muscles from maybe an alignment not being totally right. What can I do now before maybe going to a chiropractor and doing something more structural in the long term?
Thank you. Yes, great question. Definitely, that's something that can change. And essentially, what's happening with everyone is you have the muscles, you've got the bones, and you got the fascia, and you have other tissues. But these three are important because this is what most people are just thinking muscles and bones, right? Most people now fascia has become, in the past few years, fascia has become kind of a keyword. When I first started stretching it, there wasn't no talk about it. But what's happening is the bones in everyone are out of their natural resting positions. Everyone is in substituted positions. And that is because there is an accumulation of dense fascia and scar tissue in very specific muscle groups. And that's across the board, and it's also specific to the individual. So across the board, everyone I've met has very tight hamstrings, which means that the femur is going to be rotated in a non-optimal position, which is going to cause, depending on how it's rotated, it's going to cause a certain predictable type of problem, either a hip joint problem or low back problem, or maybe in the knee or the foot. And so everyone needs work on the hamstrings. And then each person has very specific muscle groups that they need targeted based on their conditioning, based on their genetics, or some kind of traumatic event that they've gone through that they haven't processed physically and perhaps in other ways as well. And so, so in terms of adjusting the bones, yes, you want to adjust the bones. You want them to be in their natural rotations. But the question is, if you get them adjusted, how long do they stay there? And usually what happens is that the forces that caused those bones to initially to be substituted they don't come back. They're already there. So before long, after the bone has been adjusted, it gets brought back into that default position. And so then what needs to be addressed is the tissue that's causing those bones to be out of alignment. Now, this is where you see a lot of physical therapy come in and a lot of personal training where they think, okay, well, let's strengthen the abdominal walls, let's strengthen these muscle groups, and let's strengthen this. So that way those muscles can continue to keep the person in the proper position. And then let's try to get the person to stand up straight. No. That doesn't really work. And the reason for that is because the muscles are very high. They spend energy and they need energy. So we would have to be eating, for example, if we didn't have fascial tissue, we'd have to be eating all day long because the muscles would have to be contracting all the time just to keep us in one position and move us through space, right? So instead we have this fascial tissue, which is like a resistance matrix in the body. All these strands are going in every direction. And so then whenever you make a movement, your muscles contract. And then when you're done with the movement, the fascia is like a spring, brings you right back without requiring energy because it's not contractile. It's not wired to the brain for contraction. It resists. So that way the muscles can do the movement and then the fascia can kind of do the sustaining as well. And so in the case of your hips, there's probably a couple muscle groups where there's just too much dense fascia. And because the fascial tissue has way more force than the muscles, there's no amount of strength training that you could ever do that would actually change that permanently. And so you can adjust the bones, but that fascial tissue is going to pull that tissue right back out, or pull that bone right back out. And so we'd have to identify where in your body there's an accumulation of that tissue, and you can't feel that. That's the other part of this, which is quite interesting, which is that most people's attention goes to what they can feel, And usually it means it doesn't feel very good. And so then they're trying to get that area to feel good. Oh, I feel tense here in my hip flexors. How do I stretch those out? Sure, those need to get stretched. Everything in the body needs to get stretched. But what about your hamstring on the other side? My hamstring's fine. I don't feel that. But wait, why don't you feel it? I don't know why, but I feel this and it hurts. I'm like, yeah, but why don't you feel that? They're like, well, it doesn't matter. I feel it. I'm like, we need to get you to feel this. And then once you start to go into those areas in your body where you don't have feeling, where you feel like you don't need any work, you'll start to identify as you keep removing the dense tissue that that's actually the source of your tight hip flexors, or that's the source of the thing that you've been conscious of. And so then it becomes a process of finding in your body where you have a lack of feeling, a lack of sensation, a lack of awareness, and then working on that area, even though it seems like a complete waste of time, and then seeing if that gives you results. And usually what will happen is you start to realize, like someone said, oh, this makes me aware of how much more work I need on my body. You start to become aware of that in that area. And so you find that in your body through where there's a lot of force and, where there's not a lot of sensation and where there's a lot of force. So when you're working on your body, you can go through 8 major muscle groups in your lower body. So it's not too complicated. You don't have to even remember the names of the muscles. You can think of the body as having eight different zones. And then you find one of those 8 or 2 of those 8 that have a lot of force and not very much sensation. And then you keep working on those. And then what happens is as you're stretching, sometimes you'll hear your bones adjust. And so what's happening in that case is that you're meeting the match of the fascial tissue. That fascial tissue has hundreds and hundreds of pounds of resistance, and it has the hold on your bone and is keeping your bone rotated. And as you start to use force and resistance and tension, and then moving as you do that, that fascial tissue starts to meet its match within your body, and then it starts to break apart. And then your bone will adjust, and then over time, you'll have made enough change to reach critical mass so that your bone no longer gets pulled into that substituted position. And then it's very funny because at that point, most people forget they ever had the problem because they're on to the next thing. And so then someone will be like, oh, they come in for a session, they'll be like, oh, can we work on my hip or whatever? You know, they've been saying that for months, right? Or weeks or whatever. And then they come with, can we work on my shoulder? I'm like, sure, how's your back? What do you mean, how's my back? It's fine. I just need to work on it. But your back is, oh yeah, that's fine. They completely forget they've ever had it, even though they've had it for like decades. And so that's an important concept, which is that the body can repair and it can change. It just, you need the proper forces aligned. You have to address the substitutional forces in the body. And so send me an email and then we can identify which muscle groups in you need that. And then there are very specific self-stretching exercises that you can do and assisted stretching exercises that you can do to change that.